Good day. At this point, we are to discuss the asepsis and infection control. So, this one is a review of your chain of infection. We know that the chain of infection is composed of the following components: the causative agent, which may include microorganisms such as bacteria, viruses, and fungi. The reservoir is the area wherein the microorganisms or the causative agents usually reside, and multiply. Thirdly, the portal of exit. The portal of exit is necessary for the microorganisms to be spread to another host. And of course, the mode of transmission is the manner how these microorganisms usually go from one host to the other. Usually, it could be in a form of airborne, droplet, and with the use of other mechanisms such as vectors and, of course, your blood-borne diseases. The portal of entry is where the microorganisms or the causative agent enter through the host. It could be in the form of the nasal cavity or the nose, the mouth, the any mucosa in the body. It could be the rectum, the vagina, and the respiratory tract. And of course, the microorganism needs a susceptible host for it to thrive. So any break or any break in the chain of infection usually prevents occurrence of um, infection in an individual. So therefore, the primary key is to prevent microorganisms. So we have to protect patients, protect the healthcare personnel, and promote quality healthcare. So now, how do we break the chain of infection? Eh, The single most important is, of course, doing hand hygiene. Okay, it is necessary for us to break the infection since we will not be able to transfer microorganisms from one person to the other or even to oneself. Another form of breaking infection is by doing cleaning, disinfection, and sterilization. Remember that they are different concepts in terms of asepsis and infection control. When we do say cleaning, it is just the removal of physical dirt from an area such as the table, the stethoscope, your thermometer, and other medical equipment. Disinfection is technically using an agent to remove microorganisms, but not it does not kill the pores of these microorganisms. So therefore, some may still thrive in the specific area or medical equipment. And sterilization means that you kill the microorganism as well as its pores. Another um, method of breaking the chain of infection is, of course, with the use of barriers. Barriers such as your what we call as your PPE or personal protective equipment, such as your gloves, mask, and face shields or eyewear, can also prevent the infection. And of course, we can also utilize isolation systems wherein we do remove the patient or remove an infected individual to the crowd so that it may not spread the microorganisms, such as what uh, when we do isolate patients who have COVID-19 at present times during the pandemic. And of course, surgical asepsis. Asepsis itself is termed used to describe an absence of infection. So during surgical asepsis, procedures or aseptic procedures are utilized during surgeries for us to prevent transfer of microorganisms from the environment to the patient being operated. So at this point, we are to discuss first hand washing. In the question here, what is the single most important means to prevent the spread of infection is, of course, by performing a good hand hygiene practice. And most of the organisms is isolated uh, or can be found on your hands are the following. So it could be Pseudomonas aeruginosa, which may cause at times skin infections, at times respiratory infections, and others. E. coli usually is seen in patients who are having diarrhea, such as the Klebsiella. Klebsiella may also contribute to the development of respiratory pneumonia. Staphylococcus epidermis, Acinetobacter baumannii, your Staphylococcus aureus, Enterobacter cloacae, your Enterococcus faecium, Klebsiella pneumoniae, and of course, Pseudomonas species. So hand hygiene is defined by the US CDC, or the Centers for Disease and Control and Prevention, as a general or an umbrella term, okay, to describe to or an umbrella term to cover the following: performance of hand washing, aseptic hand wash, alcohol-based hand rub, and surgical hand hygiene and antisepsis. So generally, hand washing is washing hands with plain soap and water. When we do say aseptic technique, it is washing hands with water and soap and other detergents containing an antiseptic solution. So alcohol-based hand rub, of course, is with the use of alcohol-based, no, your alcohol-based solutions such as your isopropyl alcohol 70%, ethyl alcohol 70%, and other forms of alcohol. And of course, your surgical hand hygiene or antisepsis is hand washing or using an alcohol-based hand rub prior to operative procedures. So, what could be now the specific indications for hand hygiene? So, okay, before patient contact, it is necessary for us to perform hand hygiene to remove or at least reduce, because we cannot really remove presence of microorganisms on our hands. Okay, so to reduce the number of microorganisms in the hand, we also perform hand hygiene before donning gloves, when inserting a central venous catheter or any other catheters, or doing an invasive procedure to our patients. So before we insert urinary catheters, peripheral vascular catheters, or other invasive devices that do not require surgery. Of course, we also perform hand hygiene after patient's contact. Okay, when we touch patient's skin, because patient's skin as well as ours contains certain microorganisms, and we want to reduce the number of it so that we prevent infection. So contact with any body fluid or excretions coming from the patient, even if you have intact skins, no? And contact, of course, to wound dressings of your patients. And of course, you wash your hands or do perform hand hygiene after removing your gloves. Surgical hand hygiene or antisepsis is using either an antimicrobial soap or an alcohol-based hand rub. An antimicrobial soap, we usually scrub the hands and forearms for length of times recommended by the manufacturer. And for the alcohol-based hand rub, we just follow, of course, the manufacturer's recommendations before applying it. At this point, we are not to elaborate more on surgical hand hygiene, but more on the medical hand washing. Okay, so we'll focus more on the regular hand washing. Don't worry because you will be going through surgical hand hygiene discussions when you go onto your prior to operating room and delivery room uh, duties. So the recommended hand hygiene techniques, you can do hand rubs and or hand washing. Hand rubs is when you apply palm to palm of one hand and rub hands together, covering all surfaces until dry, using an alcohol-based hand rub. And hand washing, of course, you utilize warm water, running, take note, running water, and of course, with hand soap. So wet hands together with water, apply soap, rub hands together for at least 15 seconds. But currently, take note, currently, uh, it is recommended that at least 20 seconds should be performed to should your hand hygiene to last. Okay, at least. So rinse and dry hands with disposable towels, and use towel also to turn off the faucet. You do not want to touch the faucet that you use to open the water supply, because microorganisms are also present in there anyway. So this is just information coming from the CDC, the time spent of cleansing the hands of one nurse per 8-hour shift. So hand washing with soap and water, about 56 minutes was uh, spent by some nurses based on a 60-second hand washing episodes per hour. For alcohol-based hand rub, we do spend 18 minutes per 8-hour shift based on a 7 20-second hand rub episodes. So it shows that uh, alcohol-based hand rubs reduce time needed for hand disinfection. So meaning that there would be more time for the nurses to do alcohol-based hand rub. But remember, utilizing soap and water is necessary if the hands are visibly soiled. Okay? So, what now could be the agents or solutions that we can utilize? For the hand washing, we can utilize your chlorhexidine 2% and 4% or any antimicrobial soap. Okay? It could be in the form of liquid or bar soap, but we do more recommend the liquid soap so that we may not contaminate the bar soap so that other nurses or other healthcare workers can utilize it. So hand hygiene or hygienic hand rub, we can use 70% ethyl alcohol. Also, we can use 70% isopropyl alcohol. So surgical hand disinfection, yung prior to operative procedure, we utilize chlorhexidine 4% and 2%. So at times, you can also utilize uh, other alcohol-based hand rubs. So I've mentioned earlier the before and after of hand hygiene. Okay? But the World Health Organization is promoting the 5 moments of hand hygiene. When meaning when should you wash your hands or perform hand hygiene? So first, before touching the patient, before going to the patient, coming for example, you're in the nurse's station. Then before going to the patient, make sure that you wash your hands, either with soap and water and or alcohol-based hand rubs. Second is before a procedure, before doing anything to your patient, be it a vital signs or inserting catheter, removing of uh, IV catheters. Thirdly is after procedures or an exposure to body fluid risk. Okay, for example, you drain the surgical drain of the patient, you drain the indwelling Foley catheter of the patient, you performed vital signs monitoring to your patient, make sure to wash your hands or perform hand hygiene. Your fourth moment is after touching a patient. And of course, after touching any, no, after touching a patient surrounding. So, when, for example, you uh, came in the room of the patient, and when you go out, after going out, you perform hand hygiene because uh, kumbaga, these are the equipments or areas that your patients are touching as well. So meaning there could be microorganisms coming from the patients transferred to this equipment and surrounding. So if you touch the patient's bed, you do hand hygiene after. The doorknob, okay? So these are just the following areas that when you touch, you should perform hand hygiene, okay? So now let's go through the procedure one by one. Later on, I'll be showing you a video of this hand hygiene, but let's run through the procedure. So take note that the purpose of performing hand washing, this time we're doing hand washing, okay? Meaning it will use or utilize soap and water, okay? The purpose, but anyway, even if we do hand hygiene using alcohol-based hand rub, the same purpose applies. Okay? So the purpose number one is to reduce the number of microorganisms on the hand. I have mentioned that we cannot really actually remove all of these microorganisms, but at least we reduce the number of them. Second, reduce the risk of transmission of microorganisms to clients. Reduce the risk of cross-contamination among clients from one patient to the other. And lastly, reduce the risk of transmission of infection organism to yourself. Okay? So the following equipment and supply should be present. Of course, your soap, liquid soap, warm running water, disposable or sanitized towels or paper towels. Uh, it is optional to have an orange wood stick. This is utilized to remove uh, presence of dirt under the fingernails, but it is recommended for you to have short fingernails, so you would not use orange stick anyway. So the preparations before doing hand washing is, of course, nails should be kept short. Removal of by the way, nails should be kept short, since these short nails are usually less likely to harbor microorganisms, no? And it less likely scratch the patient and puncture your gloves. Removal of all jewelries are recommended. So microorganism usually lodge to this jewelries, no? And under rings, for example. Removal of this facilitates proper cleaning of the hands and arms. So check the hands for presence. Next would be check the hands for presence of breaks in the skin, such as the hangnails or presence of cuts. So a nurse who has open source may require work assignment with decreased risk of transmission of infectious microorganisms due to the chance of acquiring and, of course, passing on an infection. And lastly, prior to doing hand hygiene, you stand in front of the sink and do not allow clothing to touch the sink during the procedure, because we do consider that the sink or around the sink is contaminated. All right, so let us now move to the procedure itself of doing hand hygiene. So first, if you are in the patient's room already or you have met the patient, make sure to introduce yourself and discuss to the patient what you are going to do and why is it necessary. So next is that, again, of course, stand in front of the sink and do not allow your uniform to touch the sink. So turn on the water and adjust the force, regulate temperature until it is warm. So warm water usually removes less of the protective oil in the skin. Okay, and take note that there are different types of faucets that we do have. Okay, there are all faucets that are hand operated, with operated by knee levers, foot pedals, elbow control, and infrared control, or those automatic dispensers. Make sure that you are familiar on how to use these different kinds of faucets. Third step would be make sure to wet your hands thoroughly by holding them under the running water and apply soap to the hands. So hold hands lower than the elbows so that the water flows from the arms to the fingertips. Thoroughly wash hands and rinse your hands. Make sure to rub hands from palm to palm, palm to right palm over the left dorsum with interlaced fingers, and vice versa. Palm to palm with fingers interlaced. Back of the fingers to opposing palms with fingers interlaced. Rotating rubbing of left thumb clasp in the right palm and vice versa. Rub tips of fingernails opposite palm in a circular motion and vice versa. And of course, rub each wrist with opposite hand. Later on, I'll be showing you. You can see this in the video that you'll be watching. And of course, after doing so of about 20 seconds or more, make is of course you rinse your hand. Make sure that there is presence of friction because friction is necessary to mechanically remove microorganisms present on our hand. So this is the guide coming from the World Health Organization. First step again by wetting your hands, all right, with warm water, getting your soap, rub from palm to palm, palm interlaced, okay, with the knuckles, your thumb and fingers, rotating motion on the fingertips, and of course, rinsing them. Make sure when you dry, later on I'll be showing it in the next slide. When you dry the hand, you should use paper towels or disposable towels by pat drying them and use that towel to close the faucet if it is hand operated. So thoroughly pat dry the hands and arms. It is necessary. So dry hands and arms thoroughly with a paper towel without scrubbing it. So moist skin becomes chapped rapidly and usually do dry the skin when you rub vigorously. So make sure that you pat dry them only. Discard the paper towel in the appropriate container after doing so. But make sure to close the water if it is hand operated manually using the paper towel. Never touch the faucet again. Okay? And of course, turn off the water by using what I have mentioned. So that ends the procedure. So healthcare facilities are intended to heal the sick, but they are also the source of infection. So as healthcare workers, we must wash our hands and do our responsibility to reduce the risk of healthcare associated infections. So with that, thank you very much and watch the video later on to enhance your learning on hand hygiene.